To me, there are two reasons for that. One is related to the external environment in Ethiopia, and the other is more towards the DEVCO and ECHO internal momentum. The first thing about the environment in Ethiopia relates to the fact that Ethiopia shows good economic growth, and that economic growth is being translated into an expansion of infrastructure, expansion of basic services, on water, on schooling, on healthcare, spreading out also to the more marginal areas. So in that sense, there is an environment with a government that has adopted a good policy document on resilience issues. And in addition, there's a good mature safety net which provides a lot of food and cash assistance to chronically vulnerable people. On the internal side, we also have a good momentum. It started off last year when Commissioners Georgieva and Piebalgs kicked off the Resilience Initiative in the Horn of Africa, the so-called SHARE initiative. And the SHARE initiative stands for Supporting Horn of Africa Resilience. It is an initiative to foster closer working relationships between ECHO and DEVCO, but it's also there to invest more in the marginal areas of the Horn of Africa. This has been picked up quite a lot by our field staff, by the delegation in Ethiopia, by the ECHO office in Ethiopia. They've been coming together, they've been thinking about how to translate this into practice, how to exchange better information, how to come up with an investment strategy. And we have been supporting that from headquarters by going on a joint mission, by looking very regularly at each other's documents, and in that sense coming closer in our approaches.
The frequency of disasters increased from 1 every 6 years to 1 every 4 years, and clearly it undermines people's capacity to rebuild their coping mechanisms and livelihoods. From a humanitarian perspective, the 2011 drought in Ethiopia was severe, probably one of the worst in 60 years, but contrary to Somalia, did not lead to famine. Therefore, there was a need to do business differently and to go beyond our traditional way of working in responding to this vulnerable population. Resilience is not a new concept per se and refers to the capacity for a person, community, or country to resist to a shock. There was also a clear commitment from the government of Ethiopia, often associated to major droughts and famines, to stop the vicious drought cycles from major also donors and from key implementing organizations in Ethiopia to do business differently. The good ECHO-DEVCO collaboration and joint planning were indeed key to maximize the impact of EU external assistance on the drought-affected populations. The areas the most affected by recurrent droughts in the country basically are these ones. We can't cover with our funding all these areas. Therefore, we have identified 7 clusters that are the most recurrently affected by droughts, and where ECHO has been intervening for years in these areas. Basically, here, within these 7 clusters, geographical clusters, we are targeting 2.5 million people, which corresponds basically to 20–25% of the people that are in need countrywide. So it means that this is probably obvious that ECHO and our colleagues from development cannot cover all these areas. So that's why we have to play an advocacy role towards the major donors in order to bring them on board and cover the areas that we are not working in. So this is an example of our interventions. For example, Borana, it's one of the clusters where we are intervening. And you will see that there is 6 districts that we are focusing on with a multi-sectoral approach. So you will see there is disaster risk reduction, there is a wash component, there is a nutrition component, there is a health component. So all these partners mentioned here in the map are together working in order to provide assistance to the most vulnerable populations in these specific sectors. So what is very interesting about the initiative, it's the geographical, I would say, focus. We are targeting the areas that are recurrently affected by severe droughts and hazards. The second component that is very interesting is the fact that we are working on a multi-sectoral approach. We know that most of the time the big issues are under nutrition and food insecurity. So by giving a kind of entry point in these two sectors, we can really complement with other sectors, such as the wash sector, such as the health sector, such as the disaster risk reduction sector. So we know that to tackle undernutrition and food insecurity is not necessarily a question of having access to food, but it's also a question sometimes of the bad quality of water that is going to create some diarrhea for the kids, under 5 kids. So then it's going to have an impact in their nutrition status. So we have to be a bit more broader, and I think that this undernutrition and food insecurity deserves a wider coverage in terms of sector.
What I particularly like about our approach is that we start from the same aims, we start from the same analysis basically, on what are the causes of the problem, and we have a kind of common log frame that we refer to. Although then we come in with complementary approaches. You do it from a relatively short, medium-term perspective, and we do it from a much longer-term perspective. You also work with different partners. We can work with government, you work with NGOs. But it all brings the different activities to the same cause. Besides government, we work with international organizations. We also work with the NGOs. But one of the key elements that we bring, in addition to what ECHO can bring, is that we put squarely the local government in a coordinating role. Mm-hmm. So in that way, by joining hands, we try to create synergies, and I think that is an interesting one.
I would say that the enhanced coordination with major donors and local authorities and key implementing partners is also is key, because it's a way for us to provide better assistance to the most vulnerables. We have our annual funding decisions. So we will use part of our funding in order to support the resilience building approach. But as you know, ECHO is not only focusing on resilience building type of activities. We have also severe emergencies. We have, for example, ECHO is contributing to support 420,000 refugees, 366,000 IDPs, and of course we have also our mandate to support populations affected by epidemics outbreaks. When we are funding our clusters, our geographical clusters in different areas in the country, as this is areas that are recurrently affected by droughts, if a big catastrophe has to occur during the period that we are supporting these areas, we will have the capacity to really inject more money and give some flexibility also in the framework of the contracts that is being implemented by our partners to shift quickly from a resilience building mode towards a more emergency mode.
After the 2011 drought, we mobilized through the instrument for stability about 14 million euros for quick response, relatively quick responses in some of the most drought-affected areas. And those programs are still ongoing at the moment. In the meantime, we have been mobilizing the so-called B envelope of the 10th EDF in the framework of this SHARE program. This morning, actually, the Commission took the decision to approve the 50 million assistance in the framework of SHARE, which provides money for not only for livelihood support, but also for support to the safety net, particularly a so-called risk financing mechanism, and to nutritional elements. So that's another injection of funds into the resilience program in Ethiopia. And the third component will be in the framework of the 11th EDF, and we are programming that at the moment. End of the month we should have our first draft. But we have identified sectors that are very important for resilience. It includes agriculture and food security, it includes healthcare, and in the future we are slowly moving towards rural energy. All three of them are quite important to invest in resilient communities.